see on page 9 of the financial statements, our payables amounting to 586 billion. The amount increased by 427 million. That's 73% increment. I just ask, does this increase, this astronomical increase of the water bill from 158 million to 586 million, showing an increment of 73%. When I read your response, management response, I say the increase in the area as a result of increased consumption from the newly constructed buildings over the years. Why? So it was over the years. Why was it not reflected in the previous year? Because 2024 is 158 million, but it was now 2025 when it's more. Because if it was over years, it should have been fairly distributed. At first I thought maybe because additional building in the year in question. But when I look at your financials on page 29 on construction progress, when you look at buildings, additions during the year is nil on page 29. So can you explain the reasoning? Because now the other one is defeated if you say it was because of the new buildings. There were no additions.
13,533, but the actual was 13,099, which means you're not able to absorb all that you have. But now, you look at your statement of outstanding commitments. That's on page 38. You had outstanding commitments of 158 million. And yet you had resources that were available on the other side. Nothing, no commitments were made during the year, but instead you accumulated further areas going up to 457. So really, for heaven's sake, have you not mistreated your own people who deserve to benefit from these resources? Aware that even what you had, you are not able to absorb all. And in that under-absorption, there was 524, which should have at least offset the areas of 158. Can you maybe get an explanation to that one?
Given it is live, you see, does it go off?
I apologize. This is a typing error. It is the same areas for water.
Same areas for water?
Yes. It is the one that had 158. It was just typed in the wrong line.
Okay with that.
So this could not go in the correct line of utilities?
It could go, but this was a typing error and I will always endeavor to correct it.
Okay, like I said earlier on, that we're expecting continuous improvement and growth from your side and supported by you. Thank you.
Madam Chair, I want to hand over. We are handling the...
As I pass this one.
It is going to give you now I'm about to hand over. We are handling the accounts, bank accounts, we want to yeah. But I want to put this on record as well, that we have been these accounts were always being, bank accounts were discouraged. And this is the first time I'm seeing more units having a number of bank accounts. And I think that's why we're dealing with that issue with even outstanding money on them. They have discouraged that must be running, I think, one single account? Treasury single account. So it might be kindly correct. Madam Chair, thank you very much. I can hand over back to you as I change my tone to the normal one.
Recently we received equipment from Ministry of Health to support the NATO unit, and this will move us from level 2 NATO unit to level 3 when all the equipment are being installed. We have actually one pediatrician undergoing training for neonatology right now at National Referral Hospital. So we hope after completing that special training in neonatology, we'll be able to better manage the units.
So is this, with the capacity of 30 beds, is this one?
It's 8 hours. It's 8 hours shift.
So what is the right ratio? Because this 1 to 3 might not be realistic. Remember, we shall come to Lira. The people of Lira will give us the actions. You will give a false picture here when it's different home. If you give an impression that the neonatal unit is okay, when it's not the case, it is a service to your people. So make sure you speak to facts.
Thank you, Chair. We'll collaborate very quickly on the kind of...
If there is anybody on this team that is directly responsible for that area, please, you can delegate to any of these ones to answer on your behalf. It's your rent. That's why you moved with them.
I don't have somebody immediately.
Okay.
Yes, I would therefore go and speak about the dialysis. We have 5 dialysis machines in the hospital. 1 machine is dedicated to patients who are infected with hepatitis B, so which means the general population of patients with chronic renal diseases now have to utilize their 4 remaining dialysis machines. Dialysis was established in 2023, and our average sessions that we provide per month is up to about 200 sessions that we provide to the dialysis patient. The 4 are not adequate. In fact, we have already written to our sister institution, which is Chirudu, to ask for additional support. We have asked for 4 more dialysis machines to supplement the current one that we have. So we think when we have that added, at least will relieve us from the pressure. The theater has 5 operating rooms. The 5 operating rooms are not adequate because right now we have very many specialists. We have up to 19 specialists at the Regional Referral Hospital. And those in the surgical disciplines are quite many. We have a pediatric surgeon, we have the general surgeons, we have the orthopedic surgeons, and each of these, the gynecologist, the ENT, all these specialists require particular days to work. When you combine with emergencies, it's not adequate to provide the service and the turnaround time. So that space is inadequate.
What would be the adequate space? What's the gap?
I think right now,
Don't think.
when you look at the volume of patients, because every year we operate up to 10,000 patients.
What is the total population of the whole referral?
The regional referral serves a population of 2,650,000. So when you look at the surgical burden is high, and we think